Everyone to the first Region 5 meeting of 2021. It looks like we have 15 participants on the call so far. So I thank you all for taking the time to join us this morning. I know it's a really important meeting. I just have a few things to go over before we get started. Like I said, this is Kirby Phi. I'm listed as Amy Holland if you've joined via WebEx, but this is Kirby Phi with the department. Per Governor Lee's Executive Order 71, this meeting is being held virtually and being recorded, so it will be posted to the department website within the next day or two. With that being said, if you're not speaking, please make sure your phone or your computer is muted just to prevent any feedback. And when you're asking questions or making any comments, please state your name before doing so. It's helpful when taking the minutes. I'm going to go ahead and go through the attendance. I'm going to go through the individuals who have signed in via WebEx first because I can see their names. And then we'll go through the call-in users. So like I said, this is Kirby Phi. We have Adrian Dokes, Allison Parker, Amber Hampton, Debbie Hillen, Karen Carruthers, Kimberly Ladd. Let's see if I can get this to move. Cooper or Cal Bryant, Kurt Hipple, Laura Durham, Mary Linden Salter, Sherry Allen, and I know we have Patience Mead on the call, and we also have Rama Muhammad on the call. Is there anyone else who has joined via phone that I haven't taken your name?
Heather Vestal, TMHCA.
Hi, Heather. Anyone else? All right, Sherry, I'm going to hand it over to you. Or not Sherry, Debbie, and Sherry and Amber.
Hey, can I throw in real quick? I would love to hear from Patience and Heather so I can put them on. And maybe I have it, but I don't think that I have all of their contact info. I'd love to have that. So just throwing it out.
Yes, this is Heather. Mine is Heather Vestal, all lowercase, and that's V as in Victor, E as in East, S as in Sandy, T as in Tom, A as in Apple, L as in Laura, at TMHCA-TN.org.
Okay. So I will echo what Kirby said. Welcome. And thank you for taking the time out of your busy schedule this morning to meet with us. I believe each of you received the agenda. Sherry flooded you with emails. You got an agenda, you got minutes. You also should have a blank needs assessment form, and you should have some other resources that the department sent regarding dashboard data, state data, and also the previous needs assessments from 2020 with regard to each region, the adult committee, the CAB committee, and the children's committee. So before we get into all of the detailed parts, I would ask, is there a motion to accept the minutes as approved, as presented?
I'll motion to accept them.
Thank you.
Amber.
Is there a second? Amber, you seconded it? All right, all in favor signify by saying aye or wave.
Aye.
Any opposed? All right. The big part of today's discussion is to focus on the needs assessment. Before I do that, though, I actually got an email at 8-something this morning. So I want to talk about it for just a minute because all of this plays into needs assessments and different things. As y'all know, Governor Lee has done several executive orders to allow for the COVID and extra situation and ways to handle those situations. TennCare has done the same. And one of those was the use of telephonic visits for behavioral health and treatment services. That was previously to expire the end of March. In an email this morning from Mary Shelton, that has now been extended to June 30th, 2021. The expansion of telephonic visits for behavioral health treatment services and treatment. So that was something that just popped up on the emails first thing this morning. One of the other things, and I want to lead in with a couple of things before we actually get to the needs assessment, because I think they play a role here. One, if you will remember, well, back in October, I think it was dated from TennCare, again, Mary Shelton, was the IMDs, the Institute for Mental Diseases, and Mary Shelton and Kurt, y'all are both on here, and y'all can probably definitely help me out here. But it was in essence that any facility, residential facility that was 16 beds or more, had to offer at least 2 forms of MAT services. Quite honestly, that caused a big stir with some of our PATAS members because of philosophies and whether they were doing MAT or not, and over 16 beds, this, that, and the other. Well, it was supposed to went in effect January 1. It did not. It got postponed to February 1st, and now it's been postponed to March 1st. And that is with regard to that. There was also a thing where up to 30 days per year for substance abuse treatment. And I'm going to ask Mary Linden, if you would give us a brief synopsis of this, please.
Well, I think you've hit the high points, but I think what you're asking is for more information on the 30-day limit, and that limit is something that the state, the IMD rules, and because of our waiver and such, hadn't previously been implemented, but because of some recent legislation, the state, had to implement something to bring Tennessee into compliance with that IMD rule. So we're continuing to work on some alternatives. Perhaps I've talked to Mary Shelton about whether or not they can submit a subsequent 1115 waiver to mitigate that limit. And I think she was fairly receptive to that. So as soon as we hear back from the TennCare Bureau, then hopefully we can move forward on something like that. But that certainly won't be anytime soon. That would take quite a bit of time. So in the meantime, there will be a 30-day rolling year limit of residential substance abuse days, and that does include your detox days. So people would, let's say they went into treatment on May 1st. That 30-day limit would be until May 1st of 2022, and then they could go back to treatment again for a second time. Make sense?
And we'll talk more about that. Yes, Cooper.
Same question came up at Region 3 meeting in Chattanooga, and Jeremy, my executive director, is willing to talk to and answer questions if you want to get together and I can set up a time for you, because there's some allowances to that 30 days.
There is a way to get additional days if you and what is it called? If you're
I was looking for that terminology myself.
I know, but it's an alternative. What's it called? Alternative, but it's a pretty high bar to meet.
Yeah.
Cost-effective
option for 15 days.
Yeah.
Yeah.
The problem is it's a pretty high bar to meet. You basically have to meet criteria for inpatient care, which means danger to yourself or others, in order to get a step-down residential treatment authorized as an alternative. So it's not something that's terribly practical.
Yeah, I mean, the meeting I set up with Chattanooga is Mayor Shelton was on that call as well with Jeremy. So let me know if you guys need anything like that.
Yeah. Okay, we will. Thank you, Cooper. I will tell you from our UR department, we're already hearing also the breakdown with 15 days at a time. So this is important for our discussion as we go into needs assessment, especially on the substance side.
Let me just quickly nip the 15 days at a time in the bud, because there was a managed care company that talked about limiting use to 2 15-day stays, and Mary Shelton, as my understanding, intervened in that and told them the 30 days was subject to medical necessity, not an arbitrary 15-day limit. So if any managed care company is still doing that, I think we need to report that to Mary Shelton.
Okay, I'll get the specifics. And that is important, as I said, as we go into to this discussion. Kurt, would you be willing to talk with us briefly about the Medicaid block grant waiver and what the impact and what that looks like for our state and our region?
You're talking about the block grant waiver that was recently approved in the final days of the Trump administration?
Yes, sir.
Yeah, I think that pretty much everything that's been said about that still holds. I think that this is an initiative that Governor Lee and his team are very excited about. We are still, we are not the department that would institute that. That would fall with TennCare, so I don't want to speak for them on that. Obviously, there has been a change of administration on the federal level, and I think that there is a lot of, I would imagine, I won't say I know, that there's a lot of communication back and forth about how that will impact setup. But that's really all I can say at this point. TennCare would be better to answer those questions. Sorry, Debbie.
Okay. It's not in one of these documents that I printed off and have here on my desk, but Mary Linda, help me remember, was there not a statement in there about the IMDs, and that the IMDs was technically not a covered service?
The IMDs have technically never been a covered service according to CMS. That's why I say the original waiver that TennCare submitted exempted Tennessee from that prohibition. And so it was only recent legislation that basically canceled that out. And so we were then subject to the IMD limit that practically every other state in the nation has been subject to. Now, there is discussion on a federal level in Congress about whether to eliminate that IMD exclusion altogether. Many states have struggled with implementing, treatment services to address, the addiction epidemic because of that limit. But right now, it is the law of the land. It has been since the 1980s.
And again, the importance there is the impact that could have on residential treatment for those that we know who need that level. Again, just information going out. All right. Kirby, you asked me earlier about there was something to share on the screen. Can you pull up the needs assessment form just so we have it to look at as we enter this discussion?
Sure, just give me 1 second to get it pulled up.
And with that, every year we are tasked with coming up with 2 mental health needs assessments, priority 1, priority 2, and also, and one of those is for adult, one of those is for children. And the same thing applies on the substance abuse side, looking for 1 adult, 1 for children. And that was part of why I was wanting to know whether or not the school liaisons had made it to the schoolrooms yet, and where we were with the safety net for the uninsured children. Had all that been implemented yet? Also,
I definitely know they've both been implemented. I do know that.
Okay. Okay. I know you said you probably didn't know that was somebody else. Which schools in our county actually already have a behavioral health liaison in them? And if not, if you could get that information for us.
Yeah, so you would like the information for the schools that have school-based behavioral liaisons in them within Region 5?
Yes, ma'am.
Okay, I'll reach out for sure.
Okay. All right. If you have any of your documents there from last year, I'm trying to go to Region 5 here on my papers. We put as one of our priorities for mental health to establish a crisis stabilization unit in Region 5. And the other one was to expand school-based services for families and youth that encompasses prevention, education, and support regardless of their ability to pay or insurance. On the substance abuse side, it was to increase funding for detox and treatment, and also to increase funding for MAT programs in Region 5 to offset the cost of having to deal with the DEA associated with regulations and rules for telehealth. So those were the 2 we did last year. So I'd like to open the floor up and ask you to, what are you seeing in the past year as, let's talk about mental health first, for mental health needs. And so I'm going to open the floor up for anyone on that subject.
So I'll jump in, and one of the big things that I have seen is,
if you will, identify yourself, please.
It's Amber Hampton. So one of the things that I have seen is an increased need for affordable housing, and obviously I'm in Rutherford County, and that has been something that obviously it's always a need, and I know that the state has put out like the CHI funding and that kind of thing. The timelines on that are really fast turnarounds, which makes it hard to purchase and acquire property for the timelines. And so that's been one thing, especially for folks that have significant persistent mental illness, to be able to have housing that is suitable and appropriate for them, because a lot of times places like apartments and that kind of thing, they have a lot of issues in apartment complexes because of neighbor issues and that type of thing. So I just wanted to throw that out there as the first thing right off the top of my head that I know that we've seen a lot of.
Okay, other ideas? Not a day to be shy. I will, I don't know whether it be a Kirby or a Kirk question. Can you respond to what any discussion there was regarding the CSU in Region 5? Because I know the commissioner has to, I mean,
Let me
she got
call you
this
back,
one.
Matt. Sorry, I was on the other line. Can you repeat the question, Debbie? Hello?
You're
Debbie,
muted,
you're on
Debbie.
mute.
I sure didn't know I was muted. Okay. So the one I'm asking about is the CSU that we put in last year for Region 5. And I was saying that I know the commissioner gets, I mean, she got 7 regions and we all turn in 4. So she got 28. That's not counting the adults, the children, and the CAB needs assessment requests. So she has to look at all of them. I get that. But can you tell me, was there any, or what was any of the discussion around the CSU in Region 5?
Hey, Debbie, it's Kurt. So I think a couple of things were going on there. I think everyone knows, or maybe Region 5 doesn't know, but the Cherokee gave up a CSU, an existing CSU, in the region that they were serving. So a lot of focus over the last several months has been trying to reestablish a CSU that was in existence at one time, so that there wasn't any loss of continuity of care. So I think that has been kind of the focus of Rob's team on the CSU area. This is something that I know that y'all feel very passionately about. So I don't think it is an unworthy thing to put in again. As you know, Debbie, you and a lot of people on this call have been around. These are situations where needs that get expressed sometimes do not are not addressed in the exact way that they are expressed. Sometimes it takes some time to be able to mount a response to those needs that are expressed, but let the community, letting the department know that this is a continuing issue is always a good thing. And we take a look at those. We look at the funding. We look at the priorities that the governor has, and we make the best of those situations.
No, I appreciate that. I didn't mean to put you on the spot, but I like to anyway.
I wouldn't want it any other way.
She does have a hard job prioritizing and working within what her budget allows, and that's understandable. But I do know, having chaired this committee for several years, off and on, is that has been in, I bet if I went back and pulled the last 4 or 5 needs assessments, that's going to be in there from a mental health perspective. So I would open it up for discussion as to whether or not that is that something we want to resubmit, or do we want to submit something else? And what is that open discussion?
Debbie, this is Amber, and I wrote the needs assessment for that a couple of years ago. I would still very strongly say I feel like that's a need. I know at one point in time I read something like in a paper or whatever that they were considering, volunteer behavioral health was considering putting in a CSU, but I haven't heard anything since the one article that I read. But that was over a year ago that I heard anything about that even being considered as a possibility. I definitely think that that is still a really big issue, especially right now with the pandemic and folks. I mean, we've heard a lot of folks that are just struggling so hard because they're lonely, they're isolated, they don't have any contact with folks. And that's contributed to a lot of mental health issues. And I think that if we were able to have something like that, it would make it way more accessible.
Adrian, can you tell us how you guys are doing with your CSU, and are you always full? Can you talk with us a little bit about the one here in Nashville?
Yeah, so our CSU stays full. I mean, obviously, recently within the last year, you know, we created that partnership with the Metro Police Department. So MHC and the police department down there, they trying to get it where, you know, they are presenting with mental health crisis, they go straight to our CSU or our crisis unit down there. So it stays packed. And sometimes, you know, in other locations such as the Murfreesboro location, we try to go to our CSU as well. So, and we're covering like 24,000 consumers right now with the co-op alone. And that's just our basic level of case management. So we stay pretty busy. Can't even lie about that. We're probably at capacity on a daily.
And I would assume, and based on what you just said, and I remembered your partnership with Metro, is that between your own clients and them, that my assumption would be that you would always be at capacity, which meant need coming from outside into your CSU would be a hard fit.
Yes, very much so. But I can definitely reach out to our CSU department and kind of get like a trend of what we're seeing, and then I can definitely let you and Kirby know for sure.
Okay.
I think that would be really helpful. This is Amber, by the way. I think that would be really helpful as we're looking, particularly addressing this again this year, because you guys are going to be the ones that collect everybody from our counties.
Right.
That's going to be the default, is everybody's going to go to Nashville because Nashville is more central. And I think that that's going to be really important to stress.
Yeah, I'll definitely reach out today to the program manager of CSU. And then I'll get the information to you, Ms. Debbie or Kirby.
All right, that'd be awesome. Thank you, ma'am.
You're welcome.
Other mental health issues. So it looks like we have one, and we'll come back for a vote on them here in a little while. I'm just trying to make a list right now. The other one I heard was the need for affordable housing for those with mental illness. And I do agree with you, Amber. While a great initiative, the chief funding that just come out, it's due today or tomorrow?
That timeline is almost impossible to follow with purchase and acquisition and turnaround.
Yeah, you can't get site control. I even looked at it. I got site control of property. But even me having site control of property, for example, in Clarksville, I couldn't even turn it around. And I'm pretty good at turning around housing stuff, but I couldn't even turn it around.
Yeah. If there's any way for the powers that be that are on this call, if there's any way to kind of expand that timeline, that would be so incredibly helpful, because right now real estate is at a premium. And so like Debbie said, if you don't already have real estate, trying to acquire and turn something around in the time period, it is almost impossible. I'd be shocked if there's any array of folks that could feasibly do that.
That's a good solid statement there, Amber. It really is. All right. So we have other mental health providers on the line with us. And so what are some of your needs that you're seeing from your communities, our communities, but the communities that you're actually in? Is there anything that has come or surfaced to the top as it relates to dealing with the COVID issue. You know, I know that there's all the stuff about the increased suicide, increase in mental health issues, increase in substance abuse issues, and it goes back, I think it was, I don't remember, it may have been Amber that made the statement of being confined and in a place. I know for me, I go crazy some days when I can't open these blinds back here because I'm on a Zoom all day. That's why I like to see your faces. But for a lot of people, just the confinement and what that's doing to the mental health status of people.
Absolutely. This is Kimberly Ladd. I echo that, all of those sentiments, echo Amber's thoughts on that for sure.
And this is Amber again. The other thing that I will say that we've heard a lot of is a lot of folks are doing phone appointments for therapy rather than telehealth. And that's been really tough. I don't know how many folks, obviously, like in different counties and stuff, and how everybody's doing it, but I know that the telephone, obviously that's kind of a step below telehealth because it's a little less personal, but that's been a barrier that a lot of folks have had a really hard time adapting to.
And Kimberly, I'm glad you spoke up because I also had a note, and I don't know if this plays into anything that we're doing or looking at for needs assessments, but what about the last time we met was on, I guess, October 22nd, was about the ACES toolkit. Has that got implemented in Murray County?
No, ma'am, not yet. We had a new executive director step into position at Prevention Alliance of Tennessee, and we're still waiting on that team to put the final touches on it, but I'm hoping it'll be ready soon. I'm sorry it's not ready yet.
Well, no, I thought, well, if we had an update, or is this something that we, because as it relates to children, is this something that might be a need for children with mental health issues and so forth? So I just wanted to, again, just throw out some ideas and put them on the table. While y'all are thinking, I'm going to give you a couple of the other regions' needs assessments, maybe to prompt your thinking. There was one that said enhance the workforce development among mental health providers that serve children and youth. There was one by embedding social workers and psychiatrists within emergency departments. I'm not sure about that one. One under mental health for Region 2 was to increase funding of the department's grant-funded services to allow for salary increases in order to mitigate the loss of trained professionals going to higher pay. One was to increase the number of paid SOAR positions. One was to decrease the amount of time to 24 hours between the first signed certificate of need, the placement, and to increase access to outpatient counseling and psych through the development of a mental health crisis. We talked about hours, so let me go on to the next one. It says establish it's quote, handle with care, quote ended, program that will create a three-way partnership between first responders, mental health providers, and schools to help use trauma-informed care practices for children returning to school after contact with the community, first responders. increase the number of transitional housing beds for families in order to decrease the wait time so families wouldn't be separated. Increase support for LGBTQ youth to include services with focusing on housing. And you have all of these with you. I just thought maybe it would prompt your thinking here. So those were some of the ones that was listed under the mental health 1 and 2 from last year. You know I have a daughter who's a teacher. And I know she has a friend who is a social worker, and she's one social worker for the whole county. And she is stretched thin. I actually went and took my grandson. He invited me to his little 4-H presentation. He won his school, so he had to go to the county. So he invited me to go, not his mama, which I thought was awesome. And I took him out to eat afterwards, and she, at 7:30, she was just finishing up. And she'd been in and out of homes all day. I know from talking with my daughter, they have kids in school who they, as teachers, have an overwhelming concern for because of potential abuse at home. And while the teachers have reported it, this virtual learning stuff has really caused the teachers to be overly concerned with the health and the welfare of those children because they can't get a social worker in the homes fast enough to deal with all of this. So I don't know if that's in any other county. I know I hear that on a weekly basis from her. So for those
Debbie,
of you who do more of that, yeah.
I was going to say, let me add, the education system, as all of us are, they're dealing with a lot of new things. I have a lot of schools reaching out to me saying, what can we do? How can we address our virtual learners? Because, every county has a different combination. Even if they're going to school in person some, a lot of them are still at home some as well. And it's really difficult. The teacher doesn't have the training or the background in order to truly identify all of the things that may be going on in addition to other concerns that they have for that child. And even if they do have a mental health concern, they don't necessarily have, there's not a system in place to be able to reach out to that child, whether it is a social worker or a school counselor or somebody else. So there's a lot going on with schools right now.
There is. And I can tell you from her perspective, she says, I didn't sign up to be a counselor. I signed up to educate these children. And she says, her thing is, she says, fortunate for me, she says, I was raised by a counselor, so there are some things I know to look for. But I think there's an overwhelming amount of stress on our teachers, especially right now, even with the with all this virtual. Part of the time you're virtual, part of the time you're in school, and part of the time you're mixed. And what is this doing to our kids? You say, okay, is that a needs assessment for long term? I honestly, quite honestly, think it is, because I think it just had not surfaced to the level it is today. If it hadn't been for the COVID stuff, I think it's been going on.
But also, and I'm going to put in my 2 cents and my personal professional opinion as well, because it goes in together. As a former educator, I did not go to school myself to be a mental health provider. However, through learning, as an educator, I'm a mental health provider. That's part of my job, but we don't ever think of it that way. It's not completely been approached that way. That's why, in particular, the youth mental health first aid training is so important for our educators so that they can begin to see, oh, hey, there are some connections, because if I have a kid that's acting this way, 99% of the time there's an underlying reason, and I can help address that, because I need them to perform. I need them to feel safe and be able to be healthy physically, mentally, emotionally in my classroom in order to educate them. Because if they're not healthy physically, mentally, and emotionally, I'm sitting here, spinning my wheels. So kind of making that transition for educators is so very important. And again, one of the better tools that I have seen is the youth mental health first aid training. So that's just my 2 cents.
No, and Mary Ann, that's great. And my daughter would 100% agree with everything you just said. But where she would take a position is that needs to be included in the higher education while you're educating these teachers, because she said she's a tenured teacher. She says, I'm already in the throes of it. I already know what's going down. I'm already playing that mental health counselor role. I just need the resources to get help for these people. I've already got this. So maybe that youth first aid mental health that you were talking about, maybe that is something to maybe target for, what is it when for student teachers who are getting ready to go out into the workforce because they're walking in totally green and not having this education, that maybe that would be something good for, again, a long-term thing. But again, I'm hoping, and she's hoping, she's heard me talk about these new school liaisons and so forth. That's why I was wondering what schools have they made it to, and when are they going to make it to the Region 5 school system. So anyway, that's just school-based stuff with kids as it relates to mental health issues.
I agree. I think it's yes, and I think it's both. I agree with you, Debbie, and agree with you, Mary Ann. I think it's both.
I do too. So, all right. So let's talk. All right. So let's try to summarize mental health. What I have, and y'all correct me if I missed something, is the need for the affordable housing. The concern that while something is better than nothing, the phone appointments are not as effective as the telehealth, but better than nothing. But are we missing the services that those with mental health actually need? And I may not have said that right. And Amber, you could probably say it better than I did. And then the other would be to consider the youth first aid mental health as a part of a educational training program for new teachers. Did I miss?
I wouldn't limit to just new teachers.
I'm
Debbie,
sorry.
This is Mary Ann. I wouldn't limit that to just new teachers, because if teachers have not had it at all, it is a great starting point.
Okay.
Would we also want to include parents in that?
Yes, Amber.
Administrators.
Teachers, administrators, parents.
Yes.
Because that's the only other thing that I would throw out there, is that especially with the pandemic, lots of folks are at home with their kids, and that has been a big struggle, is trying to adapt and trying to figure out how to navigate life. And we hear that all the time anyways from parents that struggle with children that have got mental illness and just trying to figure out what resources are available. What do I do? But to have that as an offering to them as well, I think also addresses a different need.
And also, you know, it would be a great way to, I guess, for lack of better wording right now, target foster parents, because oftentimes we know that our children who are in the foster care system, they're already experiencing a lot of trauma and a lot of mental health issues. So that would be, and I don't know how to word that.
Well, and also is about those in the school system who touch the kids. That would include the dietary and the law enforcement that is assigned to the school.
Yes.
Yes, ma'am.
Yes, ma'am. Yep.
I think anything that can help offset the cost of that training, because it's not super expensive if you've got the trainers. The state of Tennessee's already launched several initiatives to help get folks trained in becoming youth mental health first aid trainers. But once you get the training part taken care of, it's like $25 per person to take an 8-hour class. And that's for the materials that go along with it. And so anyways, just throwing that out there.
Okay. So
It's a great door opener too for other services.
all right. So there's 3 on the table. So what would be your prioritizing 1 and 2 for me? And then who's going to be kind enough to write them? Oh, sorry, and I missed one. The other was the CSU. So CSU, affordable housing. I'm not sure how you would say the telehealth, the phone, the in-person services. I'm not sure how you state that. And then the youth first aid, mental health.
Can I throw?
Those are the 4.
Oh, I'm sorry. I like the
No.
whole CSU thing, and I know Amber's already has drafted that, so maybe she could update it. But I think the key is we need to have more data, and if we can have Adrian's data along with anything else, I think that really helps beef up that. In essence, you know, I think you know, you hear, oh well, you know, there's one in Region 4, they can use that. But if they understand that Region 4 is overwhelmed and Region 4 people go there, and we really don't have anything. And we know that we have the population from Nashville expanding out to all of the counties around Davidson County. And that's what Region 5 is, that we ourselves are overwhelmed with that. So I still think that needs to be one of them, is my, you know, throwing my input in. And then on the one for affordable housing timeline, is that a thing? Does the powers that be, Kirby or Kurt, do they feel like that timeline was made that short because they don't have the funds truly to do it? Or is it because they just don't recognize that timeline short? Because that would be an easy one to throw in that wouldn't cost as much money, unless ultimately they made that timeline small so that the funds weren't there. And then I'm always voting for education. So that's my 2 cents.
Well, I'll go back to, I got my COVID shots and I went to Marshall County because that was the first one that reached out, because I was the contact for our agency. And I went the other day to get my 2nd injection. And I walked in and the health department was full of members from the Marshall County Sheriff's Office. And having been a jail administrator there, you know, I looked to see who I knew. Of course, they've all changed over the years. But the sheriff was the same. And he and I spoke. And we were talking about my mobile bus that happened to be in town that day. And one of his things, he says, he was hoping that he could use us instead of an ER for a CON, and I said, no, that won't work. But when you stop and you look, I mean, Marshall County is an hour away, probably about an hour and a half to get up to Mental Health Co-op. And then an hour and a half back, that's 3 hours. And if you look at Lawrence County or Wayne County is about a 2.5 hour. So that's a 5-hour drive to and from to take someone to a CSU. So I think as we look at that particular one, that we would also look at the amount of time that it takes for the safety of that individual getting from point A to point B. Good morning, Clark Harrison. So, all right, so I gave you 4. We need to vote on which 2 we want to submit as a part of our needs assessment.
Hi, Miss Debbie. It's Adrian. I have already reached out to my program managers about the CSU trends, and I'm going to try to get that information by end of day, and I will definitely send that over ASAP. I have to hop on another call at 10:30, but for myself, I want to vote for the CSU as well as providing the mental health first aid to the educational system. I think that's a need. Just from the trends that we're seeing here at the co-op, we're getting a lot of kids, like at least 5 intakes a day, and they're mainly coming from the schools, and the schools just, they don't know what to do. So I think those 2 are the greatest needs for our region right now. But like I said, I'm going to hop off this call and join another meeting. But as soon as I get the trends, or even if I get the contact information for y'all to contact senior leadership directly, I will give any information directly to you guys as soon as I get it.
All right. Thank you. Thank you for participating this morning.
No problem. Y'all have a great day.
Okay. Others, how would you vote? Clark,
This
you're
is
muted.
Heather.
Yeah, Heather.
So I also as well would vote for the CSU for Region 5, as well as the Youth First Aid.
Okay. I have to ask you a question, Heather.
Yes, ma'am.
Did you know a Danny Vessel?
I'm not sure. I'm actually married into the family.
Okay. All right, go ahead. Clark, you were trying to say something and you were muted.
Saying I'm sorry I missed everything, as far as the voting process or whatever, but you can fill me in.
I'll be glad to fill you in. We're voting. We have 4 items on the table to vote for mental health, and we have to narrow it down to 2. One is a CSU for Region 5. 2 is affordable housing for mental health. 3 is telehealth versus phone services. And the other big one is advocating for youth first aid mental health for educators, administrators, parents, law enforcement that's in the schools, anybody touching the kid, and foster parents.
Oh, okay.
Amber, to put you on the spot. I'm gonna put you on the spot.
I'm fine writing the CSU one again. Like I said, I've got a template for it, so I'm good taking that one.
All right, so you're saying CSU. What would be your other choice?
I mean, I'll vote for youth mental health first aid, but I do think that in that it would be really helpful to include parents, if possible. So school administration, staff, and parents.
All right, I put parents down there. Okay. Others.
I'll go with the 2 Amber went with.
All right.
The CSU and the advocate for parents.
I'm CSU. This is Mary Ann. I'm for CSU and the Youth Mental Health First Aid.
Okay.
This is Kimberly, same. CSU and mental health first
Okay.
aid.
All right.
Hi, this is Rama. I'll vote for the CSU as well.
And what's your second choice?
I believe the recover affordable housing.
Okay. Any others that we have? Okay. All right. So it looks like it's the CSU and the Youth First Aid. What I'd like to do, and Amber, thank you for volunteering for the CSU and the update of that. Mary Ann, would you be willing to write the needs assessment on the Youth First Aid one?
Sure.
Hey, Mary Ann, it's Amber. I can send you some information too, if that would be helpful, on who we have trained in other first aid and other mental health first aids, and how we've kind of disseminated some of that information. So let me know if you need any of that.
Please do. That would be very helpful.
All right. Now for the substance abuse. Floor is open for discussion. Now, y'all know I can talk on this subject all day long. Clark, I heard that. Well, I will tell you what's going on in the substance abuse side of it, okay? And while they're all interconnected, so I'm not putting silos because they're all interconnected, but my first one would be to advocate for additional funding for detox and continuum of care. While we have, and I'll tell you why. And the state's heard me, so it's not all the way up. So I'm not saying anything that Commissioner or anybody has not already heard from me. We have been great. State and the department has been great in opening access points for people to access substance abuse treatment services. She's got lifeliners out there. She's got the ropes people out there. We got the navigator people out there. So there's been a lot of funding put out there, but it's funded positions. Now what that has done is it has put a demand on an already restricted pot of money to provide detox. If we continue as we are and we try to hold our numbers for detox to get us through the year, but because of this COVID and because of the added access points, I'm out to run out here within a month of detox dollars. And we don't see that going down. We've seen enough. Although I hold it at 6, try to. I've had up to 9 at a time because of the need coming from the ERs and partnering with the ERs. Now, that's been primarily with the navigators. That's primarily been with 4 hospitals. We just added 4 more hospitals that I've just signed MOUs on. And I got off the phone with a rural hospital this week wanting to be another one. So they are seeing the need to have people in their ERs to help people with their addiction issues. But the problem is there's not enough money to pay for the services. Do we have capacity? we got capacity. That's not beds is not an issue. It's the resources. The same thing, because part of all of it was to step them down to an appropriate level of care. Block grant is locked in at a certain amount. And while the state has been awesome at writing new grants and bringing new federal dollars in, my 30-something years, I've never seen that except the last few years. It's been great, except when the federal dollars come, as y'all well know, you got to make a round peg fit in a square hole, because it may not be what you need, but that's where the money is. And of course, you go after the money and then you try to shave off the edge of that to make it fit. So one of mine, and I will take the lead, it was I did last year on that one, as it relates to additional MMCD dollars for that, unless anyone has any objection to that. And I saw Amber's head nodding up and down through my whole discussion. But it's open to the floor for any other subject on substance abuse.
The reason my head was shaking over and over and over again is because that has been the biggest challenge, is folks want to get into treatment and they can't get into treatment because the money is not there. And you can't open that up to say, we'll help get you in somewhere if we can't get you in somewhere in the long run, because ultimately that's harmful to people. And I am 100% in agreement with, let's put more outreach people out on the streets, like the lifeliners, the ropes, all of that stuff has been very helpful, like tremendously, tremendously helpful. However, we're having to be really creative in how we navigate treatment options for folks that don't have access.
You know, I had a conversation with my SAMHSA. Well, I have 2 current active SAMHSA grants. And I was on the phone with one of my project officers yesterday morning, and she was actually I ended up doing an education lesson with her, because she comes from DC, where anybody can get treatment. I said, well, got news for you. I said, you know how many people I've served under this grant? I'm just telling you, that number of people would not have gotten served had it not been for the SAMHSA grant. And she couldn't believe that not everybody would be eligible for our Medicaid system. I said, oh, Lord, no. A few years ago, they kicked a bunch off. So it was an letter for my federal reps on a SAMHSA grant, that the importance of why that grant was important to Tennessee.
Debbie, why is it that other places can offer that? Because that DC is not the only place that I've heard of where if you need treatment, you can get in treatment. What are we doing different in Tennessee that other places aren't doing? Or maybe other places, yeah, that's the right way to phrase that question.
I can answer. I know one of the things that I keep getting places, and they said, oh, wait, you're not an expansion state. And I said, no. So part of it had to do with that, and I'm still curious as to how this Medicaid block grant thing, that waiver is going to be critical to the infrastructure of what goes forward here. So that's a big concern we have going forward right now. Some of the other substance abuse that they had, school-based prevention programs, one had to do with the NAS babies. Several of the other regions actually increased funding for detox and treatment services. So we were not the only region who put that in last year. There's also increased MAT providers throughout the state. So with that one being said, there's a lot of MAT services. They're all for profit, and that doesn't cover our indigent population. And so I do know that it's hard for the indigent to access MAT services. Number increase of recovery housing beds. To do MAT services has an added cost of dealing with the DEA, and that has enormous cost to it. And so that was one last year. One said to create substance abuse case manager positions to assist individuals from being discharged from a residential center. Again, more funding for detox beds. And increase educational opportunities for clinicians, health councils, educators, etc., and reducing the stigma. So those were some of the ones that was put out last year. So any others?
I see a lot of what you just said, Debbie. Access to care, addressing NAS. That's definitely something that we champion in our coalition and our community to improve those numbers and outcomes for moms, parents early and with their infants.
Others? You know, I always hate to be the one to think that everything we need costs money. But unfortunately, it does. And I always hate for those to be the things that we always turn in. I do know dealing with, from a substance abuse side, if we're talking about math, you've got costs associated with the DEA. You've got costs while you may be able to get, for example, we have some money through the department that pays for MAT services. That's the medication, that's the doctor, that's the nurse involvement. Now, to get treatment, I again have to put them down here in a block grant that we've already talked about is already extended, it's busting its seams. So, I mean, I can come up with different things, but it all goes back to the availability of treatment resources to fund the services. So what am I missing?
I think you've hit it on the head, Deb. I think we've got to try to see if we can get more funding for detox services for our populations that don't have the ability to pay for that, and we need more block grants in order to do that.
Well, I'll definitely take care of that one. If I come up with another one, I'll I'll send it out, and these will be sent out in draft. Now, Kirby, these are due. It got extended to what? April 15th.
Yes, they're extended till April 15th this year.
Okay. And I'm trying to find a calendar here. So, would it be okay to ask? Let's see, where are we? I had to stop and think. Can we have at least, y'all send me your initial write-ups by March 4th, and then we'll get them out for final approval and final vote, and then shoot for having them to Kirby by April 4th. Does that sound doable? Okay. The form you see on the screen, can you scroll down some, Kirby? It's the same as last year, so it doesn't look any different. Make sure you put it on the right form. Don't be like me and put it on the wrong form. Actually, I cheated. I went up and where it said, 20, I put 19 last year, and they caught me, and I had to redo it. I was cheating. But, yeah, well, I'll tell on myself. I don't have a problem with that.
And just know, because there's a lot of questions on here, and I think sometimes it can look daunting. You answer what you can. The most important piece, obviously, is the need, and you want it to be as specific as possible, but not too long. And the data to support the need, you just want to make sure it's relevant data to the need that you're putting there. Obviously, we want you to go through and answer the other questions because the department staff, they look at this when they're developing the 3-year plan. So they're going to be looking through these forms. If they see a need that they're like, yes, this has been on, this is something we can do. They're going to want to look at these forms to see the answers to these questions. So if you have any problems along the way, don't hesitate to reach out.
And also, in one of the emails, there is the department's fast fact dashboard with a bunch of links, and also the state and county planning resource with a bunch of links. So in looking for data to support the need, there's some data there that you can definitely take advantage of. I know last year I had my own data as it related to the issue, and that's probably where, and I've got some from the hospitals, from my navigators, but I'll use some of probably both of it. So whatever data that you have that can be used to make the case, that'd be awesome.
Right. Any data is good.
All right. Before I go into so first of all, I guess I need to vote. Does anybody have an objection to that one at least going in on the substance abuse side? Hearing none, I'm going to say it's okay. I would like to give you an update on the mobile bus, the mobile clinic. Y'all have heard me talk about it. It is up and moving through 5 rural counties. Those 5 rural counties are Lewis, Lawrence, Perry, Wayne, and Marshall. And I'll get a flyer to Sherry and she can send it out. It arrives in each of those counties every week. I happen to know Tuesday is Marshall County because that's when I've gone down to get my my shot for the COVID, and I stop in and see them on the bus. I turned in a report the other day to the state. We had served 169 so far on the bus, and 20 of those were people who come back numerous times. So, as y'all well know, working in rural counties, just breaking the stigma of us. I mean, that carries stigma in and of itself. So we're dealing with some of that, but we're very pleased. The state's very pleased with the number that we're seeing on the bus. So it is in those communities every week. So if you know anybody that's in need of health care and they're in those counties, please send them to the bus.
Where are they located at in Marshall County when they're here, Debbie?
In the Walmart parking lot.
Oh, okay.
In the Walmart parking lot. All right. Kirby, you're up.
All right. Stop sharing this. Okay. Pull this up. All right. Before I get started, just a few things. Kind of circling back to things that were brought up during the assessment discussion. So, hold on 1 second. Amber, you had mentioned about the announcement of funding for creating affordable housing. Did you get a chance to look at the question and answer session that is on there?
I was able to listen to a little bit of it, but I haven't listened to all of it yet.
Okay, because the full transcript is up there. I haven't checked it out just yet, but I'm sure that's one of the questions on there. I would not doubt it. So please take a look at that. And then if you have any further questions, please reach out to me and I can get in touch with NARU, okay?
Thanks, Kirby.
You're welcome. And then Debbie, with school-based behavioral health liaisons, I will get back with you on that as well. And I know we had also talked about behavioral health safety net for children. So Tuesday is our statewide planning and policy council meeting. It's open to the public. It's going to be held virtually. It starts at 10 a.m. If this is something you're interested in attending, please don't hesitate to reach out and I could send you an invitation to log in via WebEx. But I say that because the director of Behavioral Health Safety Net, Katie Lee, is actually going to be providing an update on the Behavioral Health Safety Net for children to see where we are now. It began September 1st. So if you're interested in hearing about that, please join us. Again, that meeting will also be recorded. So if you can't attend, it'll be on the department website and you can watch it later. Okay. So just a few updates. First, obviously, needs assessments due April 15th. I think we've talked about that enough. If you have any questions at all, please don't hesitate to reach out to me. I'll be happy to help. Secondly, the announcement of funding for the FY21 creating affordable housing. The department seeking proposals from agencies and organizations throughout the state to develop new, safe, quality, and affordable permanent housing options for individuals experiencing mental illness, substance use disorders, and/or co-occurring disorder. An additional focus of the funding is for individuals ready for discharge from one of the 4 regional mental health institutes, including those who are uninsured. Completed proposals are due close of business tomorrow. And as I had mentioned on the department website, which I'll have a link in here that I'll share right after the meeting, Sherry, if you don't mind to send out, it'll tell you there's a question and answer section in there, as well as step-by-step on how to complete this proposal. The FY20 joint annual report between the Planning and Policy Councils and the department is completed, and it's been posted to the department website. I encourage you to check it out if you can. It highlights the accomplishments throughout the department over the last fiscal year, and also highlights accomplishments within the statewide and regional planning and policy councils. So I encourage you to check it out if you have the time. The department is receiving a new federal grant to expand the system of care across Tennessee network. The 4-year, $12 million grant from SAMHSA expands SOCAT services to 13 new rural counties for service availability in all 95 counties. Over the past 3 years, SOCAT teams across the state, utilizing high-fidelity wraparound services, have been able to maintain a 90% success rate of keeping children, youth, and young adults in their homes and within their communities. In the application, the department grant writers focus on rural and distressed areas of the state. Counties receiving services under this grant include Bledsoe, Clay, Fentress, Grundy, Hancock, Hardeman, Jackson, Lake, McNairy, Morgan, Perry, Scott, and Wayne counties. And for more information on that, you can visit www.socacrosstn.org. Let me see here. The department is also receiving new federal grants. Yes, ma'am.
All right. And this was focused on children?
Yeah, it's system. Yeah, SOCAT is children and families.
Okay.
The department is receiving a new federal grant to expand criminal justice services for Tennesseans living with addiction. The $6 million grant from the U.S. Department of Justice will cover 10 project sites. Services under the grant begin with a collaborative community review of services under a standardized model called Sequential Intercept Model, otherwise known as SIMS. The county-specific report is then used to prioritize needs and make decisions about spending additional funding. The new grant builds on a previous $6.5 million grant from the Department of Justice that is currently serving 11 Tennessee counties. Additional strategies employed by the grant following the SIMS model include law enforcement and other first responder diversion programs for people experiencing substance use, embedding social services with law enforcement in order to rapidly respond to drug overdoses, and evidence-based treatment such as medication-assisted treatment, as well as recovery support services, including transitional or recovery and peer recovery housing and peer I can't even speak recovery housing and peer recovery support services. And that's what I have.
Okay. Questions for Kirby? All right. Last, and I tried to look in the minutes and I may have overlooked it because I think someone kindly volunteered, but it's not noted here, to serve as chair of either the adult or the children's committee. Everybody wake up. Hey, I just figured out Cooper's somewhere in a hotel room. I recognize the vents behind your head. Yeah. We really need someone to, even if it's as a part of this meeting, that would take the lead and let us know what's going on with the children. I know your time is valuable, and we don't have, we're all part of all the committees, but if someone could just take the lead for the adults and for the children so that we could focus on that and meet that part of our requirement as a council. Pretty please. Is Kimberly still on here, or did I lose Kimberly? I lost Kimberly.
Kimberly had to step off for another meeting, Debbie.
Yeah, that's what I was just there looking at her name. Let's reach out and see, because Kimberly's doing that stuff with ACES with children in the schools. Let's see if Kimberly might take a lead with making sure we stay up to date on children's stuff. If you're not here, you get volunteered. And even if you're here, you get volunteered. So just beware. I have no shame.
I don't mind being the one to reach out to her, Debbie. And I didn't write it in the notes because I don't remember anybody volunteering last time. But I mean, maybe I zoned out on that part. But I think that my ears would have perked up if I had heard that.
Yeah, I may have been dreaming it. All right. What about the adult? Marianne, what about you? Would you do that for us?
Debbie, I would love to, but right now I have more on my plate, I have more on my plate than I can handle. I can't even talk. I can't think right now. So just being honest, because I know I won't be able to do it justice.
All right. I've got people that says caller 3 and caller 4, and I don't know who you are. What about the adult? All right. Well, if we can get one, then we'll try and work on the other one. Kirby, maybe there's something you and I can talk about offline.
Sounds good.
Coalitions report. Any coalitions have any report to make? All right. I did see Lawanda, but I see she's off. Kubra. Where are you at, Kubra?
I am in Orlando. And we're staying in this lovely hotel, and there are like 1,500 rooms. There are 9 cars in the parking lot. 9. It's very, very sad. My husband has an office here, so I come down with him and work in his office. But today I stayed in the hotel room. Anyway, we're all mobile, so it doesn't matter where we are. We all work.
No wonder you still had your robe. I would too.
But it's really sad when you don't, change into your clothes early in the morning, then you don't all day, and then you realize, oh my goodness, it's, evening, it's getting dark outside, you're in your robe. Anyway, thank you. We're still working with TenCare with all the changes that's coming through. So if you have any questions, and if you, no matter how simple or how difficult you think, or how complicated you think the questions might be, don't hesitate to reach out, please. We are here to help you understand what's going on and what the changes are. And Jeremy is very hands-on, my executive director, so he will be able to help clarify a lot of stuff. So reach out to me. And also, we're still doing our sponsorships in the community. A lot of things are virtual now, but if there's any event going on, let me know and see what we can do regarding sponsorship and support. So that's United Healthcare.
Blue Care, Blue Cross, Blue Shield, Mayor Group. I know I saw Lawanda, but I saw her name pop off. Okay. Anything else? Clark, how's the Veterans World going?
Oh, it's all over the place right now. We're so understaffed, and we hired a lot of new staff also. But right now we're dealing with a lot of the veterans that was in the COVID hotels. They have to get out, and really we don't have any place to place them now because Operation Stand Down is just not funding their hotels anymore, and Centerstone is running out of funds for them. So it's a struggle right now, but we're doing the best that we can do. We're trying to get some of the veterans. We're trying to get some of the veterans that's in the grant per diems and We've been working on Patriot Place also to try to get them vaccinated. They need to get their vaccination.
Well, I gave the okay for that to occur.
Okay. Well, actually, of course, I know, we was out there last Friday, Mission Barbecue. It was last Thursday, I think. Mission Barbecue came out, and we went door to door, and because I got to see them for first time in a while, and I kind of missed that interaction that having with the veterans, and I can tell that also though they're a lot of them just need to get out and do more, But right now they're kind of isolated. But we're doing what we can. I mean, we got a lot of veterans like up in a lot of the rural counties, like at Midfield and places like that we don't get up to see that often. So it's a struggle right now, but we're doing the best that we can do.
Right. Other comments?
I was going to introduce Karen. There's a girl on the phone, Karen Carruthers. She is our new Zero Suicide Initiative Director. We are serving all of the state of Tennessee right now. We've got partnerships with several different agencies across the state. But I just wanted to introduce her to you guys because this is her first meeting, just to kind of pop on and say hello. So.
All right. Now it shows she has a camera.
I turned my camera on. Hello, everyone. And I'm just excited that Amber called me a girl. It makes me very happy. It's nice to see you all, and I'll be looking forward to participating in future meetings. Amber's my supervisor, so I appreciate her providing this link so I can be here this morning. So well, nice to meet Welcome. You all.
Maybe next time you can tell us about the Zero Suicide Prevention Project.
Sure.
Okay. And how it's working in our Region 5.
Will do.
All right. Sherry, you remember that? Because I won't.
I've already got it down. Karen, you better be ready. I'll send you all the information we need. And we appreciate it. That'll be exciting. Thank you.
Debbie, can I ask anyone that did the pit count this year, how did that data system work? For Amber, did you do it up in Murfreesboro?
I did. We were using the same data system that I was telling you guys about the year before. I mean, we're using the ArcGIS where we're putting everything in Rutherford County at least. And it worked really well. I mean, for us, I feel like it works. The only thing that I'm iffy on is that they have you drop dots of locations, which I get why, but a lot of folks are really protective of where they live, and we don't want that to be necessarily public information. So we'll drive a little ways away and then drop our dot as far as where they're at, but it's still cool because you can pull up the map and see where everybody's at.
I've been doing counts for the last 15 years, and I just think this year was the worst one that I ever encountered. Especially with just the observation point of it and the no personal contact that you can have and all of that, man. It's just, I just don't feel like you're getting the proper data that's needed, to justify it.
Did y'all do it for all I know it is the HMN. Did you do it for Central Tennessee?
Yeah, it was broken down. It was broken down in certain counties. Well, like myself,
I had we do Rutherford.
And I had Marshall, but the continuum that Debbie, the one with Ray Sanchez, it went from we only did like 3 counties, which was Marshall, Montgomery, and it was another one. But we only did like 3 counties, and those, I guess, was the major 3 counties that they was going to count just for that continuum.
Wow, because we always did it for the 23.
Yeah.
21, 23.
Needless to say, I'm dissatisfied with it, but that's just my opinion. I got out and did the best I could do, but it was just this has changed. You know, I don't deal with changes too good, but I'm in the position where I have to go with the change. You know, but maybe it will get better. But I just don't think that the proper data was being taken.
Yeah, we broke it up a little differently this last year, and we used GIS maps and broke it up into regions across the county. And we had volunteers sign up, and we had volunteers do the street count. And then all of the outreach folks did the encampment count for folks that were actually out on the street. And that worked better for us than any other year than we've done it before.
Oh, okay.
Maybe can they get away with not doing all the counties? I mean, there were 19 counties and there were 2 cities with H&M. Can they do that?
What? I don't know. I gave it up.
I don't blame you. I hate it.
Me too. God.
5 years I said enough's enough. But you know, interesting enough, because I know some of the information that goes into the application, and I know the application, I think a lot of that has been waived. I still get emails. It's the fact nobody reached out to us for our count for transitional housing.
Well, I asked about that, but I guess that was considered the how did they put it? Because I say, of course, you know, in Marshall County, I always count them, you know, as far as the veteran component of it. But she said, no, we were just doing the shelter. But aren't they sheltered? It was like
they meet the definition. The transitional housing meets part of the definitions, but part of the application also includes veterans data. How many are actually in GPD? How many are actually in? So there are questions, but I didn't even know it had occurred. But yeah, you're right. It would have been before the end of January. I don't know. I didn't have to do it.
It's all about a survey now, you know. So they're going to have this list of survey that you do. And I don't know.
All right. Any other comments? Questions? You just want to say hi. All right. Again, I thank you very much for your time this morning. Thank you for your work. I look forward to seeing the needs assessments in here by March 4th. Sherry will have to remind me because, like I said, I'm in the midst of getting ready for Joint Commission. And if it ain't Joint Commission land or something like that, it goes right over this head. So, but I will get mine done. But bless each and every one of you. Stay safe. Well, one question is, how has COVID impacted what you've been doing? Other than you have to do everything virtually, and you don't have that field warm contact that we're all used to because of the field we're in.
Right.
Are you all staying safe?
Yes.
How many of you got vaccinated? I know Sherry raised her hand, but I know Sherry did.
I'm so paranoid. I won't even eat in the hotel restaurant. I just do not leave the room when I'm here. I just can't. I'm not kidding you. I bring my own sheets, my own pillows. And I only go out of town if my husband is going to be gone for a week because I hate to be alone for a week with a computer face. No. I won't do anything social. You know.
Kubra, the only person to go to Orlando and stay in a hotel room.
Yeah, but there's nothing to do, you know. I'm not going to go into any parks or anything. No way.
It's better safe than sorry, for sure.
Yeah, and it's also my work week. You know, I'm not going to leave my computer. I'm in the hotel room with my computer, so.
I'd be taking that computer to Disney World.
Kirby will be sitting there working with mouse ears on her head.
Yes. No, I'm just paranoid.
That's why my camera's not on. You caught me.
All right. All of you be safe, and God bless you, and we will see you when? When's the next meeting, Sherry? May 6th. Is that right? All right. We'll go from there. Bye, guys. Thank you.
Bye, everyone.
Bye.
Bye, everyone.